10 signs your feet tell you about diabetes. Diabetes can affect many parts of your body, including your skin. When diabetes affects the skin, it could mean that you have undiagnosed diabetes or prediabetes. Your treatment for diabetes needs to be adjusted. It's time to talk with your doctor if you notice any of these warning signs on your skin. 1. Shin spots. This skin condition is common in people who have diabetes. The medical name for shin spots is Diabeticdermopathy. You may also hear people refer to this condition as spotted leg syndrome. When this condition begins, you usually see round or oval spots, which often develop on the shins. The spots may be brown or reddish-brown in colour. Early on, these spots often feel scaly. As they flatten out, they can cause small dents in the skin. Diabeticdermopathy. Because these spots are often brown and cause no symptoms like itch or pain, many people mistake them for age spots. Unlike age spots, these spots often start to fade after diabetes is well controlled, usually within 18 to 24 months. Diabeticdermopathy can also stay on the skin indefinitely. While these spots are harmless, anyone who develops them and hasn't been diagnosed with diabetes should be tested. If you have diabetes, tell your doctor about these spots. Some people who have diabetes and shin spots have a higher risk of developing complications from diabetes like neuropathy, which is nerve damage that can lead to weakness, numbness, and pain. 2. Darker area of skin that feels like velvet. A dark patch or band of velvety skin on your neck, armpit, groin, or elsewhere could mean that you have too much insulin in your blood. This is often a sign of pre-diabetes. The medical name for this skin condition is Athesis nigricans. Athesis nigricans on the neck. Often developing on the back of the neck, this condition may be the first sign that someone has diabetes or pre-diabetes. 3. Hard, thickening skin. If you have diabetes, hard, thick, and swollen-looking skin can develop, even when diabetes is well controlled. The medical name for this condition is Scara Diabeticorum. Often developing on the upper back, the skin thickens and tightens slowly over months or years. This condition can also occur on the shoulders, neck, or elsewhere, but never on the hands or feet. Scara Diabeticorum. Some people have discoloration where the skin is hard and thickening. While the skin hardens and thickens, the condition is painless. 4. Open sores and wounds. Having high blood sugar, glucose, for a long time can lead to poor circulation and nerve damage. You may have developed these if you've had uncontrolled or poorly controlled diabetes for a long time. Poor circulation and nerve damage can make it hard for your body to heal wounds. This is especially true on the feet. The open wounds are called diabetic ulcers. If you have diabetes, check your feet every day for sores and open wounds. If you see a sore, cut, open wound, swelling, discoloration, or other change, contact your doctor right away. 5. Outbreak of small bumps. Uncontrolled diabetes can cause extremely high levels of triglycerides, a type of fat that circulates in the blood. If this happens, you can develop a skin condition called eruptive xanthomatosis. Eruptive xanthomatosis. If you have undiagnosed diabetes or diabetes that is not well controlled, these bumps can appear on your skin suddenly. After the bumps appear, they soon develop a yellowish colour in lighter skin tones. If you have a darker skin tone, you may see a greyish colour with a yellowish hue beneath. You'll usually find these bumps on the buttocks, thighs, crooks of the elbows, or knees. They can form anywhere though. No matter where they form, they are usually tender and itchy. Once the diabetes is well controlled, the bumps tend to go away. 6. Yellowish, smooth bumps or patch S on and around your eyelids. These bumps and patches develop when you have high levels of fat in your blood, which can be a sign that you have poorly controlled diabetes. The medical name for this condition is xanthelasma. Regardless of your skin tone, these bumps and patches look yellowish or yellowish-orange in color. Xanthelasma. The yellowish bumps and patches usually appear in about the same place on or around both eyelids. These bumps and patches can feel soft or somewhat hard. 7. Infections. Diabetes weakens your immune system, which reduces your body's ability to fight off harmful germs and increases your risk of developing infections. Fungal infections like oral thrush and yeast infections of the vagina are common. Do you get several yeast infections each year? Ask your doctor if you might have diabetes or pre-diabetes. 8. Skin tags. Many people have skin tags, which are harmless growths that can appear anywhere on the skin. Sometimes, skin tags are firmly fixed to the skin. You may also see ones that dangle from a stalk. The medical name for these growths is acrochordans. While skin tags can develop anywhere on the skin, they are most common on the eyelids, neck, armpit, and groin. Skin tags. While harmless, having numerous skin tags may be a sign that you have too much insulin in your blood or type 2 diabetes. 9. Cluster of small bumps or a raised patch. Whether this skin condition is associated with diabetes is controversial. We know that most people who have granuloma annular do not have diabetes. Several studies, however, have found this skin condition in patients who have diabetes. One such study found that people with diabetes were most likely to have granuloma annular over large areas of skin and that the bumps came and went. Another study concluded that people who have granuloma annular that comes and goes should be tested for diabetes. Granuloma annular. This skin condition causes bumps and patches that may be skin-colored, red, pink, or bluish-purple. 10. Yellow, reddish, brown, or purplish patches on your skin. When this condition begins, you'll often see one or a few reddish-brown spots on your shins if you have a lighter skin tone. People with darker skin tones often see purplish spots. These spots aren't itchy or painful. The medical name for this condition is necrobiosis lipoidica. These spots grow slowly, becoming one or more patches that may be yellow, reddish, brown, or purplish. In the center, you may see waxy skin that is thinning, blood vessels, or both. Necrobiosis lipoidica on a person's shins. The lighter areas in the reddish patches are waxy-feeling skin. Tips for healthy feet. Get to the bottom of any foot problems by using a mirror or asking for help. Check your feet every day for cuts, redness, swelling, sores, blisters, corns, calluses, or any other change to the skin or nails. Use a mirror if you can't see the bottom of your feet, or ask a family member to help. Wash your feet every day in warm, not hot, water. Don't soak your feet. Dry your feet completely and apply lotion to the top and bottom, but not between your toes, which could lead to infection. Never go barefoot. Always wear shoes and socks or slippers, even inside, to avoid injury. Check that there aren't any pebbles or other objects inside your shoes and that the lining is smooth. Wear shoes that fit well. For the best fit, try on new shoes at the end of the day when your feet tend to be largest. Break in your new shoes slowly. Wear them for an hour or two a day at first until they're completely comfortable. Always wear socks with your shoes. Trim your toenails straight across and gently smooth any sharp edges with a nail file. Have your foot doctor, podiatrist, trim your toenails if you can't see or reach your feet. Don't remove corns or calluses yourself, and especially don't use over-the-counter products to remove them. They could burn your skin. Get your feet checked at every healthcare visit. Also, visit your foot doctor every year, more often if you have nerve damage, for a complete exam, which will include checking for feeling and blood flow in your feet. Keep the blood flowing. Put your feet up when you're sitting and wiggle your toes for a few minutes several times throughout the day. Choose feet-friendly activities like walking, riding a bike, or swimming. Check with your doctor about which activities are best for you and any you should avoid. Be sure to ask your doctor what else you can do to keep your feet healthy.